In this video, we will be going over a home exercise program for patients following total shoulder arthroplasty. You will begin these exercises on the day after surgery and do them daily in 2 to 3 sets of 10 until your first follow-up visit.
So prior to completing your exercises, you obviously want to take your sling off. So while you're still standing next to whatever surface that you're going to lay down, you want to start with unclipping the seat belt or the pillow bolster right at the waist. And then the next step is you want to undo these two Velcros, the one Velcro near your elbow and the one between your thumb and your first finger. And then the last step will be undoing your strap over your opposite shoulder. And then if you want to lean forward a little to take this bolster out, and then have a seat on the surface that you'll be doing your exercises. Okay, so 3 times a day you want to complete your elbow, wrist, and your hand exercises. We'll start with the exercises you can complete sitting down. So the first exercise will be for your wrist. You want to bend your wrist forward and then straighten it out and back away from you. So you'll go ahead and bend towards you and then back away from you, and you want to do this 10 times. If you need to help with the other hand, you can help with the other hand. If you need to rest on a pillow, you can always rest your hand on the pillow and then complete it if you need to support your arm. After you're finished doing 10 of these, the next exercise will be rotating ulnar deviation and radial deviation. So you can just do this right on the pillow if you want to, just back and forth along the pillow. If you're comfortable enough, you can kind of do it right down at your side. After completing 10 of these, the next one you will do is just for your fingers to help with swelling. You want to make a tight fist and then straighten your fingers all the way out. And then you want to make sure to do this 10 times nice and slowly. This exercise you want to complete more than 3 times a day. If you can, try to complete this once an hour just to help with the swelling in your hand. And then the last exercise, we'll go ahead and take this pillow out. It might be a little bit easier if you stand up for this exercise. And then you just want to go ahead and then straighten your elbow as much as you can and then bend it back up. And for this exercise, you might need to help with the other hand at the wrist to just kind of bend it up a little bit more. And make sure you're getting your elbow all the way straight. Good. So to begin your exercises the day after your surgery, you want to begin with a pillow underneath of your operated arm. You want to start with clasping your hands in the middle together. You're going to help your operated arm with your non-operated side to complete this exercise. You want to go ahead and straighten your elbows as much as you can. This is the beginning part. And then from here, you're going to start to raise your arms up over your head. Keep going until your hands are slightly over top of your eyes. So you can go a little bit further to about 120 degrees. So when your arms are straight out in front of you, this is 90 degrees. So you want to go a little further past that point, and then go ahead and bring it back down to your belly button, hands to the belly button. And then you want to keep going until you complete at least 10 of these repetitions. If you don't get to 120 degrees the first time, that's okay. Just make sure to keep aiming for that goal each time. And then hold for a stretch at the end. Right about there. And then go ahead and bring back down. So she's about at 120 degrees. That's a good mark. And then after you hit that mark, hold for the stretch and then bring back down to your belly button for a rest. If you need to, you can complete 5 repetitions, take a break, and then complete another 5 repetitions. A family member might have to help you underneath of your arm at first, just because your arm will be a little weaker over the first few days. So they might have to just help right underneath of here, just to give you a little nudge. So in order to begin your exercise for external rotation the day after your surgery, you will need something like a broom or a yardstick or a dowel, even your cane, anything that you could place in the palm of your operated hand in order to give yourself a little leverage for a stretch. In order to begin placing the dowel rod in your hand, you want to make sure to keep your hand a little closer to your belly button. And then you can kind of place with the non-operative arm. So go ahead and place right in the palm of your hand. Make sure that before you begin that your elbow on the operated side is at a 90-degree angle and close to your body. Just give yourself a small gap, but you don't want to have your elbow very far out to the side. Just a small gap is okay. And then when you begin, you'll use your non-operative arm and go ahead and push right into your palm and then bring straight out to the side. You're only going to go 15 degrees, so you're going to go slightly past what we call neutral. So I'm going to go ahead and bring her arm back down and I'll show you what I mean. So if your arm is facing, if your hand is facing straight away from your body, you want to go slightly past that point with the dowel. You don't want to be all the way out here, that's a no-no. You just want to go ahead, hand straight away from your body, slightly past there for the stretch, and then go ahead and bring back down to your belly button. So we'll go one more time here. Go ahead and bring out. So here she is right at neutral. Go a little further past there. Hold for the stretch, as you see, and then go ahead and bring back down to your belly button. And then you want to complete 10 of these motions. Make sure that when you're going ahead for the stretch and you're pushing straight out to the side, make sure that your elbow is still at 90 degrees. You don't want to bring your hand down this way. Make sure that it's still bent at 90 degrees as you perform the stretch right there. And then back towards the belly button. And then after you complete 10 of those, you can go ahead and rest your arm back down and then go ahead and remove your cane or dowel, whatever you'll be using. And then you can sit up after that.
This concludes our review of the home exercise program following total shoulder arthroplasty. Please call the office with any questions or concerns regarding your exercise protocol.